Elect Trump's picks to lead the nation's top health agencies, causing concern among some doctors and scientists. As the New York Times notes, all of Trump's health nominees have pushed back against COVID policies or supported ideas that are outside, in many cases, of the medical mainstream. That includes Trump's choice to lead the CDC, Dave Weldon, a former congressman and physician who has been an outspoken critic of the public health agency and its vaccine program. He has pushed false claims that a preservative used in some vaccines is linked to autism. And Dr. Janette Nesheiwat, Trump's pick for Surgeon General, is a Fox News medical contributor who was critical of government mandates during the pandemic. These nominations come at a critical time as the United States is dealing with several health threats, including bird flu, whooping cough, and a spike in cases of measles. Join us now, NBC News medical contributor, Dr. Vin Gupta. Dr. Gupta, always great to see you. So we can talk specifically about some of these nominees, chief among them, of course, Bobby Kennedy Jr. But just broadly, as a physician, looking at the resumes and some of the views of the people who will dictate the way that these health agencies conduct business and some of the regulations that are upon us in this country or perhaps taken away, what are some of your concerns?
Yeah, Willie, a few things here. It depends on what they want to do. If they want to focus on things that are not divisive, that I'd say 95% of healthcare professionals agree on, they could do that. And so that's things like incentivizing primary care, Willie, and changing how we reimburse for primary care versus specialty care. They've actually talked about that. That would be a smart thing to do. Tackling chronic disease, what does that mean? The details matter, but that would be a smart thing to do in food safety, maybe separating the Food and Drug Administration to one on food and the other on drugs. Here's the problem. We're all expecting the negatives to really dominate here. So the big one is access to care. We are seeing, whether it's Mehmet Oz's comments on the underinsured or uninsured and the fact that they don't have a right to healthcare access, he's made that comment many times, or the fact that these enhanced subsidies for the Affordable Care Act are going to expire at the end of 2025, we should expect people will lose healthcare insurance by the end of 25, the end of President-elect Trump's first year in office. That's not a good thing. Cuts to Medicaid as well. It's the third biggest line item, Willie, on the budget, on the American budget in every given year. That's likely going to get going to be on the chopping block. That means fundamental things about healthcare access for those that they want to claim and support sort of a Make America Healthy Again platform. You cannot do that fundamentally if people don't have healthcare access in the first place. People will lose their access, and that's the big problem.
So, Dr. Gupta, let's get specific about Bobby Kennedy Jr. and vaccines. He's not alone, as I said, among some of these picks in skepticism, to put it mildly, about vaccines. Some have drawn the links, despite all the evidence that we've talked about for years, between vaccines and autism. So, for a parent sitting here this morning watching this show, should they be concerned that the vaccines they have counted on for generations and that have revolutionized healthcare in this country, measles, mumps, rubella, things like that, should they be concerned that those could go away?
Not go away. I think we should take a look at his public comments and what he's saying. What he's doing, Willie, is he's undermining vaccine confidence. He's saying that us doctors in white coats don't talk about safety. That's false. In 1986 law, Willie said that we must provide safety and efficacy information directly to our patients when we give them an immunization. So he's undermining confidence on things for which there's actually adequate information. Am I worried that more parents across the country are going to opt out of routine pediatric immunizations like measles, mumps, rubella, or the polio vaccine? Yes, absolutely. We're seeing those numbers about 8 to 10% right now, Willie, in places like Florida. I can see that number climb up to 20, 30%. And what does that mean for parents in school districts across the country? That means dealing with the fact that your child might go into a school environment where there's preventable disease. So what we're seeing here is not vaccines being taken away, but what we're going to have to contend with is a decline in vaccine confidence and more parents opting out.
So, Dr. Gupta, you touched upon vaccinations. Another major headline that's coming from these selections is that Robert F. Kennedy Jr. and some of the others have expressed real skepticism about fluoride, which is added to the drinking water in many American communities. Science suggests it's helpful. Let's get your take on that, though. There are some communities that don't do fluoride. Do you think it is a net positive for people, particularly children? And what would happen if it goes away?
Well, Jonathan, let's look at the evidence here. What RFK Jr. has done is he's cherry-picked one study in a leading medical journal, JAMA Network Open, and said that is proof positive that quote-unquote fluoride's on the way out. What did that study show? It showed a non-statistically significant finding that pregnant women exposed to fluoride might give birth to young boys that have lower IQ. Not statistically significant finding. There's some other data points that may point to that in other parts of the world. Again, not strong evidence. So if he came out, Jonathan, said we need to learn more, we need to better understand this potential association, but on balance, there's significant evidence that fluoride prevents tooth decay, prevents school absenteeism. That's why the American Dental Association, the American Pediatric organizations are all in favor of it, despite looking at the same evidence, Jonathan. If you were to say something mellow and sober like that, then we'd all say, okay, more evidence is better. He's not saying that. He's cherry-picking evidence and now claiming that fluoride's quote-unquote on the way out. It doesn't make sense. If that data existed, we'd all say the same thing. It just doesn't exist.
Yeah, that's what he does. He cherry picks studies and says, I'm just asking questions. But now he's got the power to elevate that skepticism. NBC News medical contributor, Dr. Vin Gupta, always great to have your expertise. Thanks so much. We appreciate it.